Hi, and welcome. My name is Nene. I work at the Foreign Service Benefit Plan, a health insurance option that is available to all employees at this agency. I want to introduce one of my colleagues. His name is Sam. He works with one of our partners called Hinge Health. They help people move better, and movement is medicine, which is the topic we're talking about today. So, Sam, how are you?
I'm doing well, Nene. Thank you for having me.
Wonderful. Can you tell people what your background is? What's your title?
Indeed. Yes, I'm a health coach with Hinge Health, but I'm a licensed athletic trainer as well as a national board certified health and wellness coach.
Very qualified. So, what is Hinge Health?
Well, Hinge Health is an app-driven exercise therapy pain management program. It is something that people can do anywhere. You can do it from the comfort of your home. You can do it in your office. And we deliver exercise therapy targeting specific joints, shoulders, knees, hips, low back, neck, to help manage chronic and persistent pain.
Wonderful. How common is pain?
Pretty common. It's something that most people will experience in their life. And it can be as much as half of the population at any one time is living with chronic pain. And when I say chronic pain, I'm referring to pain that is persistent and chronic in nature for 3 months or longer.
That makes sense. Anything over 3 months probably needs addressed in some way or the other. So I've been working at home for the last 2 years and I'm transitioning back to the office. What are some tips on as far as movement as I go from sitting at home for the last 2 years to back to commuting in traffic and maybe dealing with some anxieties when it comes to COVID and or just being around people again? How can I use movement to help with that process?
Well, that's not an easy answer, but that's a great question, Nene. A lot of folks, we saw an uptick in chronic pain when folks were moved out of the offices and asked to work from home, work remotely outside of the cleverly, efficiently, and healthily designed ergonomic workspaces. I mean, the offices they worked in and working from home, they may not have had those features built in. But now, as folks are transitioning back to the office, you're finding that they're having to sit in their cars more. They're having to drive longer. There's more stress in working in and around people. Some folks aren't quite ready for that just yet. Really, anything you can do for movement is when you think about a workspace, design it so that you don't sit in the same period or stand in the same posture for too long of a time period. Try to move periodically. Set little reminders for yourself on your calendar to do so. Get up and walk around the office, go to the bathroom, go get some coffee, go get some water, whatever you can do to just be more mobile in that workspace.
Well, that's good advice. About how much movement, as far as I guess minutes per week or per day, should I be aiming for?
Well, that really depends, right? I guess you can look at it from a broad perspective. The 30 minutes of some sort of physical activity, most, if not all days of the week, is what the American Medical Association recommends, along with the American College of Sports Medicine. But that doesn't have to be 30 minutes all at once. Ideally, you're getting at least 30 minutes of aerobic activity, and hopefully you're doing the minimum of at least 2 days of muscle building activities as well. But you can break that up any way that you see fit. Like with Hinge Health, it's 10 to 15 minutes a day, anywhere.
What kind of therapies do you do?
The program is it's designed by clinicians, by physical therapists, and so in the app, without getting too specific, there are 40 levels of exercise therapy, and there are some exercises that are going to be just basic stretches. Some of the exercises will be just mobility exercises. For example, with the neck, looking left and looking right. Anyone can do that anywhere. You can do that right now. You can look down, you can look up.
I can do that.
That's right. Movement is medicine. And there are also going to be some strength building exercises built into the app. So it's a nice rounded approach with the Hinge Health exercise therapies, where there are some stretches, there's some mobility, there's also some strength building exercises, and then there are going to be some functional activity building movements as well.
Well, that's great. Sounds like, anyone who gets involved in Hinge Health will definitely have some help with their physical health, and all foreign service benefit plan members have access to Hinge Health as included in their benefits. Two last questions. I just want to ask, what are your thoughts on massage therapy as far as incorporating it into your wellness activities?
Massage therapy is a great complement to movement in general. It is a form of movement, it is a form of passive movement, but it can be utilized in conjunction with a program like Hinge Health. I actually work with quite a few of my members and my clients as a health coach who utilize chiropractic care, or they use massage therapy, similar to how you would use a cough drop for your for a sore throat. It's a passive way of coping with pain so that you can then get back to movement and doing the exercise and the activities that you enjoy doing.
Wonderful. Movement is medicine. And last question, what are three things that you would tell someone right now if they wanted to improve their physical health, three things they can do right now to get on a track for better physical health?
Yeah, it's hard to pick just three, but if you were to ask me in an elevator, the first thing I would encourage you to do, Nene, would just breathe. Learn to breathe properly, and actually take time throughout the day to breathe. Set a reminder to do so. And then get up and move. Just get up and move, no matter where you are. If you're working in an office, if you have the opportunity to move around, or even if you're working from home, walk up and down the stairs a few times. Just move. Set little reminders throughout the day to do that. And then if you have the opportunity to follow some sort of structured exercise program, do so. And if pain is preventing you from doing an activity that you love doing, like running or yoga, Hinge Health can help with that. We can help reduce that pain so that you can get back to doing those activities that you love.
Improving your quality of life. That's awesome. Mm-hmm. So thank you, Sam, for sharing your expertise with us today. I think this was great information for anyone. I think the big message was move more. So we encourage you to take some of this advice and incorporate more movement into your life. Once again, I'm Nene from the Foreign Service Benefit Plan, and we are health insurance that everyone at this agency is eligible for. If you want to learn more about the Foreign Service Benefit Plan and Hinge Health and our other wellness programs, you can look at www.aspa.org/FSBP. That's AFSPA.org/FSBP. Have a wonderful day.